Hello, this is Dr. Jonathan Silverberg. I'm an assistant professor of dermatology, medical social sciences, and preventive medicine at Northwestern University Feinberg School of Medicine. And today I will be discussing the efficacy of omalizumab in patients with atopic dermatitis, a systematic review and meta-analysis by Dr. Wang and colleagues. The study results appeared in the December 2016 issue of the Journal of Allergy and Clinical Immunology. The overall summary of study results as presented by the authors is that there is no concrete evidence found to support the overall effectiveness of omalizumab for atopic dermatitis, although 43% of patients achieved an excellent clinical response. Clinical response was best in patients with lower serum immunoglobulin E, or IgE, levels. The importance of the study, as discussed by the authors, is that this systematic review and meta-analysis has clarified the existing data regarding the efficacy of omalizumab for the treatment of patients with atopic dermatitis. It has also demonstrated the need for more rigorous phase 3 clinical trials with adequate sample sizes. So let's review the methods. This was a systematic review that searched a number of different databases, so Medline or PubMed, EMBase, and the Cochrane Library, from inception through November 30th, 2015, to include any randomized controlled trials, comparative studies, or case series for review. Omalizumab dosing regimens were somewhat heterogeneous and therefore divided into two different groups for comparison, either greater than or equal to 600 milligrams per month or less than 600 milligrams per month. And for the greater than or equal to 600 milligrams per month, that included either 300 milligrams every 2 weeks or 150 milligrams every week. And for the less than 600 milligrams per month, that included either 150 milligrams every 2 weeks or 300 milligrams every 3 weeks. And clinical responses were defined as either excellent, which was defined in this study as SCORAD reductions of greater than 50%, or an easy reduction, so an eczema area and severity index score reduction of 75% from baseline, or an investigator's global assessment of clear or any improvement of a greater than or equal to 2 degrees in this investigator's global assessment. For what was referred to as a satisfying improvement was a SCORAD, or scoring atopic dermatitis index, reduction of 25 to 50%, an eczema area and severity index reduction of about 25 to 50%, or only 1 degree improvement in this investigator's global assessment severity score. And no improvement, or at least not satisfying improvement, was referred to as a scoring atopic dermatitis, or SCORAD, reduction of less than 25%, an eczema area and severity index, or EASI score, reduction of less than 50%, or no improvement of this investigator's global assessment score. And disease severity was defined as being either mild, moderate, or severe at baseline and then at follow-up. Now, the key findings of the study were that they identified 13 studies involving a total of 103 patients, and that were able to be included into this meta-analysis. 2 were clinical trials, and 11 were case series. At baseline, 60.5% had severe atopic dermatitis, 76% also had a history of allergic asthma, and 25% also had total serum immunoglobulin E, or IgE, levels of less than 700 IU per ml. 43.4% had serum IgE levels of greater than 5,000 IU per ml. About 2/3 were treated with greater than or equal to 600 milligrams per month of omalizumab. And with respect to clinical response, about 42.7% had an excellent clinical response, 25.2% had a satisfying response, and 33.1% had no improvement or deterioration in their disease state. The mean scoring atopic dermatitis, or SCORAD index score, decreased from 65.1 at baseline to 36.8 at the end of the treatment, which ranged from about 3 to 29 months. Serum IgE levels less than 700 IU per ml were significantly associated with an excellent clinical response compared with those with IgE levels of 700 to 5,000 IU per ml, with a substantial odds ratio of about 12.3. And so that's a strong effect size. No significant association between clinical response and patient's age, sex, baseline clinical disease severity, or history of concomitant asthma, or for that matter, the omalizumab dose of whether or not it was greater than or equal to 600 milligrams per month or less than 600 milligrams per month. And a major adverse event occurred in only 1% of patients. So here are my thoughts and analysis of this study. There's really very limited evidence at this point to support the use of omalizumab in the management of patients with, with any atopic dermatitis, but certainly with moderate to severe atopic dermatitis. Most of the case series and studies of omalizumab in atopic dermatitis have suffered from major methodologic flaws and selection bias. And the few controlled studies performed showed no significant benefit for omalizumab in atopic dermatitis. And so these results really impact the current state of patient management because they show us that omalizumab is not a consistently effective treatment for moderate to severe atopic dermatitis. Now, there may be a subset of atopic dermatitis patients that have more benefit from omalizumab than others. I personally have seen profound benefit from omalizumab in some patients with overlapping atopic dermatitis and urticaria or dermatographism, aka hives. Now, in those patients, the urticaria or dermatographism are histamine mediated, and which is likely to be an IgE or immunoglobulin E mediated disorder, and can be intensely itchy, thereby triggering the itch-scratch cycle in atopic dermatitis patients. The omalizumab can be quite effective at treating the underlying urticaria or hives, thereby reducing one of the triggers of itch in such patients who have that overlap of atopic dermatitis with urticaria. However, the omalizumab is technically treating the hives and not the atopic dermatitis, but only getting secondary improvement in the atopic dermatitis. So in terms of the future state of patient management, at this point, omalizumab is not recommended as a systemic treatment for moderate to severe atopic dermatitis, but there are still questions that remain unanswered. Future studies may shed light on those specific subsets of atopic dermatitis patients that might have a more consistent benefit from omalizumab. But for now, omalizumab is not a preferred treatment for the management of moderate to severe atopic dermatitis.